Governor Kevin Stitt has announced that he's disbanding the Interagency Council on Homelessness that was established by Brad Henry in 2004. So what exactly did the council do, and what impact will its demise have on Oklahoma's growing homeless population? With more on that and the governor's explanation for his decision, here's moderator Reece Wetzel with this week's in-depth conversation.
Today we are joined by three guests. First, we have Kayla Branch, a reporter with The Frontier. We have Dan Strawn, Executive Director with the Homeless Alliance. And then we have Greg Shin, Associate Director and Chief Housing Officer with the Mental Health Association of Oklahoma. Thank you all for joining us today.
Thanks for having us.
We're going to start today off a little differently. We're going to read a statement provided from the governor's office by Kate Vesper as they were unable to attend this panel. Governor Stitt believes in keeping government small and is confident that after nearly 20 years, the Interagency Council on Homelessness has accomplished their task to brainstorm solutions to reduce homelessness in the state. But the work doesn't stop. The governor trusts the pertinent agencies, especially the Oklahoma Department of Mental Health and Substance Abuse Services, to continue their work to reduce homelessness, in addition to ongoing efforts happening at the local level. Now we're going to play a quick soundbite from last Friday's meeting with the governor.
I've never seen a report from that commission. That thing has been in existence for over 20, 25 years. The amount of boards and commissions that just kind of get around and hit the taxpayer, and you pay them for mileage and all this kind of stuff. We needed a fresh set of eyes on there, so some 25-year-old commission I didn't think was moving the needle. Building housing, giving people free stuff is not the answer. I mean, you can go look at what other big cities have done to try to house people and build housing or put them up into hotels. People need jobs. People need jobs. They need the mental health. They need mental health that they need. There's the drug addiction, and there's people out there that, for whatever reason, are refusing to get the help that they need.
So, Kayla, I want to turn to you. Expand a little bit on the governor's comments in that video, and kind of explain where he's going with this idea to disband this council.
Yeah, so in his clip, Stitt talked about the need for being fiscally responsible with taxpayer funds and wanting to get a fresh set of eyes on the issue of homelessness in Oklahoma, and those kind of being some of the main reasons that he felt like this council was no longer needed. He also talked a little bit about his approach to addressing homelessness, and it was really kind of workforce development heavy. He said, people need jobs, and we're not going to, at least out of his office, focus on building housing. But he did highlight, some of the recent efforts that the state legislature has made to increase funding to mental health. That's been a big focus over the last few years, as it should be. Oklahoma has had historically a struggle with mental health access. So that's kind of some of the highlights of what he said.
So Kayla brings up some great points, and I want to turn to Dan and Greg here. As former members of the council and former chairpersons of the council, what do you think from the statement that the governor addressed, and also how do you feel about the comments that were made at that meeting?
Great.
Sure. So I don't think, number one, that the council has accomplished our tasks, even though we have been meeting for almost 20 years. That's very true. And it's a collaborative initiative by design with stakeholders from all across the state, because we need to hear in different regions of the state, there are different types of populations, different focus, areas of focus, and different types of programs that are already established. And so you need the stakeholders from across the state to weigh in and build that state plan and determine what the priorities should be of the council and what should we be focusing on. So obviously with the trends that we're seeing, especially with long-term homelessness, with people with disabilities, we call that chronic homelessness, and then with unsheltered homelessness, people who have no shelter bed to go to or any kind of temporary housing. Those are really increasing at dramatic rates. When you look at the state trends, chronic homelessness was up 115% over 8 years, and unsheltered homelessness was up 62% during that same time period. There's no way to say that the council has accomplished their tasks, and the collaborative efforts and education and advocacy that we're bringing to the idea, to the mission, is nowhere near complete. So the comments were a little confusing from my perspective from that point of view.
Yeah, I would, I mean, the governor's right. This is a multifaceted problem, and it requires a lot of collaboration. And the council, that was its function, to make sure that Department of Mental Health knew what Department of Rehab Services and the career tech system and Department of Corrections and the nonprofit community and the faith-based community were doing to address this issue statewide, and getting input from all those to figure out where the gaps in services are. And I guess the other thing that was really a surprise to me for a person who made his fortune in the mortgage business, to minimize the importance of creating housing was kind of surprising. I mean, he's certainly right. Some people experiencing homelessness need mental health care. Some of them need job training and placement services. Some of them need rehabilitation services. Some of them need access to primary health care. Some of them need substance use treatment. But the one thing that every person experiencing homelessness needs is a home. And so to minimize the importance of housing to address the issue is a mistake.
Well, thank you, Dan. And Kayla, that brings up some good points. We are in a housing crisis right now, and there's a lot of issues going on. But are the mental health services equipped to take all of this on? Or, you know, they're getting help from churches and local communities as well, but does it put more stress on this service?
The short answer is no. There are not enough mental health beds in the state for all the folks that need that type of service, that type of help. And that's been a long-standing issue in Oklahoma. And in the last few years, you know, there has been, like I said earlier, and like the governor mentioned, some investments, some financial investments in our mental health system. But I think even the State Department of Mental Health and Substance Use Services providers would all agree that it's going to be a problem that we have to continue to address, and we're really just starting that process. We're really just getting started, and there's still a great need in both access and availability when it comes to mental health services in Oklahoma.
Great. If I could respond to that also, it's very stigmatizing and labeling to say that people need to be forced into mental health treatment. And that is really not the solution to the problem. There are people with serious mental illnesses or co-occurring substance use disorders among the homeless population. Of course, that's true. We're not disagreeing with that. It could be 25, 40%, depends on the self-report of the individual, what was the cause contributing to their homeless situation. And we do need more access to mental health treatment beds. But to say that everybody that's been homeless, the reason they're homeless and they need to be forced into mental health treatment, that's not it. As Dan alluded to, housing is the base level issue here. And if somebody does need mental health treatment and they're living on the street, you can't effectively deliver the mental health treatment and help somebody stabilize or regain their mental health and wellness while they're living on the street. You can only do that while somebody's in housing, and then they have a chance to get their legs back under them, focus on getting well again from whatever medical or mental health issues they may have or whatever. So mental health is a big issue, but forcing people into treatment and trying to treat them for whatever their disabling condition is while they're on the street, that is not an effective approach to the problem.
So it's bigger than just mental health.
Absolutely. Yeah.
And then, Dan, I want to kind of go to you next. The governor had said that he's never seen a report from this council.
Yeah.
And would you both like to address that? Is that true?
Well, obviously I can't say whether or not the governor ever saw a report. I know that the GITCH, for years and years and years, as long as I've been on the council, submits an annual report as required by the executive order that created the council. That report is sent to the governor, the Speaker of the House, and the President Pro Tem of the Senate. And for the 8 years that I've been on the council, we've submitted those reports every year. In addition, there are interim issues that we address, like just last year, the council put on discharge planning statewide, and so we reported those activities to the governor's office. Now, whether that actually made it to the governor's own eyes, I don't know. But if not, it seems like that's more of a staff problem than a council problem.
And Greg, before this council was dissolved, there was work on a 5-year plan to address homelessness, correct?
Yes, that's correct. We started with a 10-year plan, and then we established a new 5-year plan, which was drawing to an end, and we were ready to start began to collect data and information to move on to the next 5-year plan that would be in place. And again, we would seek input from across the state and get stakeholders to provide what they think the priorities should be from all perspectives, whether that's in the metropolitan areas, in the densely urban areas, or in the rural counties, because this is a statewide council with representation from what we call the continuum of care. There are 8 continuums of care in the state of Oklahoma. Those are driven by HUD resources and also by private and local resources, programs and initiatives, community action agencies, for instance, in some of the rural counties, or bigger homeless shelter providers, faith-based providers in Muskogee, for instance, or Dan's got the day shelter in Oklahoma City. So there's cross-sector representation and buy-in, and it's a big deal to get a lot of input from across the state. So we were just beginning to embark on the next 5-year plan when this caught us off guard that he would end the executive order here with no formal reason or statement as to why he thought that would be an effective approach.
Now, that brings up a good point. Kayla, I can turn to you on this. We're talking about all of Oklahoma, representing statewide, not just Tulsa, Oklahoma City, the metro areas. What about the people in rural communities who might be unhoused? How is this going to affect them? Is there anyone to represent them in these situations?
Yeah, like Greg mentioned, there are continuums of care all over the state that include rural areas, but I think like you see with many other issues in rural communities, they typically have less resources. They typically have a different set of problems than you see in densely populated urban areas. Transportation begins to be much more of a problem when you're so spread out. Fewer providers. There's just a litany of issues that particularly affect rural areas. And without having some sort of place, a council, a commission where they can come, meet regularly, talk with other providers across the state, talk with state agencies, really be able to voice the issues that they're facing, it can be really difficult. And it seems that now there won't be that kind of place to converge and openly discuss the types of problems that they're facing on a regular basis.
So I want to pose this question to anybody. Does this cause worry that the rates of homelessness are going to increase? Or is this maybe not going to have a correlation? How is this going to impact Oklahoma homeless population?
Well, I think that one of the key elements that the council was focused on was shining a light on the best practice programs that are out there across the state, including in the rural areas, by the way, where there's a lot of innovation actually taking place. An example of that was the Muskogee Nation hosted one of our council meetings in Henrietta, where they have this amazing campus with a welding school, transitional housing that they built, a big resource center where they help people process job applications. Tribal members from any tribe can go there.
Kayla, I want to turn to you here. The governor says he wants to minimize government by reducing boards, reducing councils. Does that accomplish this goal? I know that no taxpayers were paying for this council, right?
Right. I think that when it comes to the size of government, it can be kind of a balancing act. And in one area, you might decrease staff, you might get rid of a council, you might end a few positions, but then you increase government over here. Government spending, new positions, a new department. In the same week that this council was dissolved, Governor Stitt added a cabinet position. And he's allowed to do that, he's authorized to do that, but I think it kind of shows that when we're talking about minimizing government, small government, it's really a balancing act. And like you mentioned, no, there was no recurring state revenue that was given to this council. A lot of people dedicated their time outside of work. Governor Stitt mentioned, maybe taxpayers were paying for mileage. Some of the council administrators and staff told me that yes, some people, some state employees use state time to do this, but it correlated with the work they were doing. If a State Department of Health employee was working during working hours on this council, it had to do with the work that they were doing at their other job as well. So I think it's kind of give and take. There's been a lot of pushback on the idea that by getting rid of this council, we've saved taxpayer dollars or we've really shrunk Oklahoma's government.
And Dan, we are running short on time here, so I'm going to let you get the last comment if you have anything you want to add.
So one of the hallmarks of the Homeless Alliance is that we facilitate collaboration amongst knee-to-knee service providers to the homeless population in Oklahoma City. And we've seen how that works to reduce homelessness and move people through the system more quickly. The council was trying to do that on a statewide level, and without it, like I said, the system will not work as well as it has.
Well, thank you. I would like to thank you, Kayla Branch, reporter with The Frontier, Dan Strawn, Executive Director with the Homeless Alliance, and Greg Shin, Associate Director and Chief Housing Officer of the Mental Health Association, Oklahoma. Thank you all for your time.
Thank you.